The governor of your home state, Washington State, along with Oregon and California, so a West Coast sweep there, you're now forming the so-called West Coast Health Alliance as a way to coordinate public health guidelines separate from the CDC. Do you support them doing that?
Yes, we have to have a strong voice. And if we're not going to get that from the CDC, although I applaud the individuals who've tried to stand up and say this is what this should look like. But when COVID hit, as I mentioned, and we were the first
Yeah,
place
I remember that nursing home.
Yeah, in that Kirkland nursing home.
Yeah.
Guess who we depended on first and foremost? The University of Washington. We had to get the rules changed actually so that the University of Washington didn't have to send every case down to the CDC and then find out the results and send it back. We all had to adapt and move quickly, and that's what we did. So in this instance now, and the University of Washington is probably one of the highest NIH recipients in the country, and so they do know a lot about health, and I think the whole West Coast has a lot of institutions. And if they want to speak to what science really represents, then yes, I think people are going to listen to that science information because it's not being provided through Secretary Kennedy.
Are you worried at all about repercussions from the Trump administration pulling NIH funding from UW? The idea that maybe there'll be some sort of punishment?
I think what the president's choices are now, he can change course. He could direct Secretary Kennedy to restore the $550 million that should go to the next mRNA vaccination program. He could tell him to restore that. He could discuss with my colleagues, even the Republicans, the ones that are now vocally saying they have concerns about this lack of science approach to the healthcare delivery system, and listen to what their suggestions are. He has options, but pretending like this secretary is delivering on science when he can't even say that your accomplishments in the first Trump administration, when your own Surgeon General said it saved 2 million lives, and you can't even confirm that, you can't even praise that effort. I think it was a sad day for his estimates about what science has done for our nation.
It's so odd because, and I said it at the time, Operation Warp Speed was one of the greatest achievements in American medical history, period. President Trump gets the credit for that. Biden gets the credit for putting the shots in the arms. And you have a Health and Human Services Secretary who has literally called it, falsely, the deadliest vaccine in history. It doesn't make any sense to me.
Well, Jake, maybe you should go back and do a little bit of history revision on that so people understand. But it's not like we just pulled something off the shelf. We had to make a scientific discovery
in 8 months
to make this happen as people were affected and dying. And so the fact that that scientific achievement was made, the question is, why would you want to stop? And I think, Bill Gates is great on this subject because he's done so much internationally with the Gates Foundation. But you got to be ready for the next one.
Yeah.
You got to be ready so you can't just rest on your laurels. And that's what he's taking away. He's taking away the apparatus to do the work, to be prepared for the next major flu outbreak, the next major, something that could happen internationally. And why should we do that? Why should we disarm? Are we going to call Europe up and ask them for help? Is that what we're going to do? Because we didn't make this investment?
No, I hear you. Democratic Senator Maria Cantwell of Washington State, thanks so much. Good to see you.